Hi kids, my name is Jeff Mullen and I'm Mrs. Lemon's father. I'm a veterinarian and today I'm going to take you on a little tour of our hospital and then we're going to ask for your help in designing some tools for us that we could use here at the hospital. This is my office, so this is where I talk to clients, and you can see I've got a telephone here on my desk and here's where I have my computer on my desk. So I spend part of the beginning of my day and the end of my day here at my desk. Otherwise, I'm usually in the other part of the hospital, which is where we'll go next. So this is the reception area of our hospital. This is where our clients first come when they walk in. And in this area, we've got a waiting area for them, a fire to keep them warm, and here you'll see a place where our receptionists stand, and they answer the phone and work with their computers in as well. When a client brings their pets in, sometimes they'll do it because the pet is sick and they're here to find out what's wrong with them. Sometimes they'll bring their pets in when they are well for us to examine and to give vaccinations or their shots. So this is the room where we perform the examination, and this is a stethoscope. This is a special instrument that we use to listen to a dog's or a cat's heart. So here's your first question as far as a tool. You see the size of this. This is what I put against the animal's chest so that I can hear their heart. This is the part of the hospital where we do what are called x-rays on our dogs and cats. X-rays are special pictures that show us the inside of an animal. And because x-rays can be dangerous for people to be around, we wear special protective clothing that protects us from the x-rays. Our patient lies here on the table, and then the x-ray comes out of this machine into a sensor underneath the table, and then the picture shows up over here on our computer screen. Sometimes it's hard for us to get an animal to hold still when they're laying on the table here. So maybe you could help us think of a tool that would help to keep our animals still on the x-ray table. Alright, now we're in the surgical room, and this is where we do operations on dogs and cats. In order to do an operation on a dog and cat, they have to be sleeping, and this is a special machine that we use that has both oxygen and a special gas that makes the dog or cat sleep. So as long as they're breathing this gas, then they stay asleep, and then we can do our operation on them. What you'll see here are some of the tools or the instruments that we use for an operation, and some of these things look like. This is the part of the hospital where we keep the medicines that we need for our patients. So you'll notice inside here we have several different kinds of different types of medicines. So when we figure out what an animal's problem is and we decide what medicine we need to use to help them, then we pick one of these medicines, and inside the bottle is where the medicines are. And then we send that home with the client for them to give the pills to their pet. But it's very important that medicine only be taken by the pet. So don't ever take any medicine that you see around your house that your mom and dad have. The only medicine that you should ever take for yourself is medicine that your doctor wants for you. This part of the hospital is called our treatment room. So when a patient has a problem that we need to help them with, sometimes we'll bring them back here and put them on this table, and then we can help treat whatever problem they have. A common problem that they would have, especially this time of year, is a cut on the bottom of their foot if they step on something sharp. And so if that happens, we can put a bandage on their feet. So this is some bandage material that we can use to protect their foot. But here's a problem that we have. This time of year, there's snow on the ground, and if a dog goes outside and walks in the snow with this little soft cotton. This part of the hospital is where we keep dogs. This is called a kennel. And what you'll see is we've got several large kennels, and each of these can hold one dog, or in some cases 2 small dogs if they live in the same household. In here, can you see it okay? In here is one of our patients who wants to say hi. Okay, so in each of our kennels here, we've got this special little grate so that we can sweep anything that's dirty down into this grate. But if you look down inside here, you see that it goes way down into this little trough down at the bottom. And that's hard for us to clean out. Maybe you guys could come up with some sort of a tool that could help us to clean this out better. This is the part of the hospital where we keep our patients that are staying with us. The patient that we have in here today had a special operation, and so now she is just recovering from her operation, and she's resting with us. We'll keep her here probably until tomorrow, and then she'll be able to go home. So we have bigger cages and we have smaller cages depending on the size of the animal. And you'll see that these are designed to be easy to clean, because keeping them clean is very important for their health. But they're also very strong so that they protect the animals so that they won't be able to hurt themselves. This is a pet carrier, and people will use these to bring their dogs or cats in, and sometimes we will transport a pet around the hospital in one of these as well. So they usually have a door on one end, and then the pet is put inside here, and then once they come in here, then we have to get the pet out in order to be able to treat them. So here's something that you might be thinking about if you want to design a cage or a crate for us. Sometimes a pet gets very afraid and they hide in the back of the crate, and sometimes they try to bite us or scratch us when we reach in to try to get them out. So you might